evening, everybody, and welcome to RAMP, Real Access Motivates Progress, live Wednesday podcast. We are so excited to be here with you today, and we not only have a great show tonight, we have some important information that you need to know. We are talking to the Executive Office of the Health and Human Services. So we're going to get right to it tonight because we have a lot of information to cover. So please welcome to the show, Kyla and James. Hi, guys.
Hi, Tina. Wonderful to be here.
Tina, it's great to be here.
Oh, I am so excited to be talking with you guys tonight and having this all go. I cannot wait to get all of this information out to all of our networks. So let's start off with Kyla. Tell everybody who you are and what you do.
Hi, everyone. My name is Kyla Walters Clinton. I am the Director of Race, Equity, and Community Engagement for the Executive Office of Health and Human Services.
And James, tell everybody who you are and what you do.
Hi, everyone. My name is James RIEOHHS. I'm the Director of Strategy and Innovation here at the Executive Office of Health and Human Services, born and raised in Pawtucket, Rhode Island, and happy to be a part of this show today.
Oh, I am so excited. James, tell everybody what exactly the Executive Office of Health and Human Services is, in case anybody does not know what they do.
Absolutely. So the Health and Human Services Office here in Rhode Island is the principal agency within our executive branch of government that manages many of our departments: our Department of Health, our Department of Human Services, the Office of Healthy Aging, the Office of Veterans Services, our Department of Children, Youth, and Families, and the Department of Behavioral Healthcare, Developmental Disabilities, and Hospitals, often known as BHDDH. We also are the state agency that administers the Medicaid program in Rhode Island. At RIEOHHS, the executive office, we strive to foster and strengthen a community-driven, equitable, comprehensive, responsive, and high-quality health and human services system for all of our Rhode Islanders.
Wow, you guys do a whole bunch for a whole lot of people. Tell everybody the importance of why we're here tonight and what we're talking about.
Well, tonight we're here to share some really important information for people that are enrolled in Medicaid benefits. Folks that were enrolled in Medicaid benefits before normally would renew their benefits on an annual basis. But due to the pandemic, in order to maintain coverage for all Medicaid enrollees, the redetermination was paused. And so for the last 3 years, people didn't have to renew their benefits. But that is about to change on April 1st. And that process is called the renewal or redetermination process. So we want to make sure go ahead.
Yeah, why is that so? I was just going to say, why is that so important to people that they need to know about this and be involved?
A lot of things changed in the last 3 years. And so in order for Medicaid to make sure that all of your information is up to date, we need people to go back in and update their information. Make sure your address is correct, your phone number is correct, because mailings will start to come out. And we want to make sure that those mailings that indicate when it's your turn to be renewed, you get. So we're asking people just to go in right now, make sure your information is up to date, address and phone number. So when those mailings come out, they reach you.
And how do people go about doing that?
There are a number of ways. You can go through Health Source RI and you can update your information that way. There are links on our Department of Human Services website, on the Department of Executive Office and Health and Human Services website. And so you can go through all those different channels to update your information.
That is awesome. And this will also be put in the chat below. If anybody is watching online tonight, I want to let you know that if you have a question, please make sure that you're typing it into the chat and I will make sure I ask Kyla or James to answer that for you. James, tell me, who is managing all of this services for the state?
Absolutely. The Medicaid renewal or redetermination process is being led by the Executive Office of Health and Human Services, along with our Department of Human Services and HealthSource Rhode Island. However, since this is a very large process that will affect about 370,000 individuals in Rhode Island, about a third of the state, we have partners all across government and in the community, such as yourself, by welcoming us onto this show tonight, who are assisting us with both getting the word out and assisting folks through this process as it begins in April 1st. It's important to note that this change was initiated by the federal government that we, as the state, have to follow. And so this is nothing that, this is not a change that the state is making. However, a change that we are being responsive to based on federal guidelines that have changed, that are essentially having us redetermine everyone's Medicaid benefits instead of being continuously enrolled, as Kyla mentioned, throughout the pandemic. Because of course, during the pandemic, we did not want anyone to lose health coverage while we were facing the illness and medical needs required of COVID-19.
It is so important for people to get involved and to know what their rights are and to know where they are in the process and to make sure that their information is all updated. Kyla, is this just for Medicaid, or what about people who get SNAP or work with Rhode Island Works? Does this affect them as well?
This change just affects Medicaid benefits. Now, related to the pandemic, you're going to see some changes. And so we want people to, that have other benefits, to just be aware and ready, but this only affects our coverage with Medicaid. SNAP supplements, they are due to change, so please stay ready, but it doesn't have to do with Medicaid. This is just for Medicaid. So in the event that the federal public health emergency ends, other program changes, they may occur. But again, that's separate from the Medicaid renewal process.
And this is so important. As the new year came and we're in 2023 and it's a fresh new year, you should be updating your information with all of your services and all of your doctors and all of your people. Every time you go to the doctors now, you got to go and update. So it also helps with all of your coverage. So if you get SNAPs or Rhode Island Works or anything, do Medicaid first, but then make sure that you're updating your information on every other service that you receive, because changes are going to be happening and going to be affected. So make sure that you are up to date on all of them. Is that a good process that you two would, stand by?
Definitely, Tina. That's a great thing to tell people, to contact their managed care organizations, and make sure that your name, your mailing address, your phone number, your email address is correct. You can access your account and make changes to your contact information via healthyroad.ri.gov or HealthSource RI. There's a live web chat that's available there. You can click on chat with us and you'll be able to chat with someone, or you can call HealthSource RI, and that number is 1-855-840-4774, Monday through Friday, except on holidays, from 8 to 6. And there's will be central staff that'll be available there to help you in both English and Spanish.
You don't want to work holidays, Kyla?
Kids might get a little upset with me if I do that.
Nice. James, I want you to tell everybody who's listening tonight what they should be doing right now to be prepared for all of this.
Absolutely. So what we need folks to do is we need folks to be ready so you can stay covered. We need folks to be ready by tuning in to what your managed care organizations are telling you as they reach out to you. We need you to pay attention to your mail as your mail is coming in, and look for mail from the Department of Human Services, the state of Rhode Island, and Medicaid, so that you are vigilant whether or not a change is happening. We need you to go online to all of those items that Kyla just mentioned and ensure that your updated information is in our systems. That is your name, your mailing address, your phone number, including cell phone number, so you can get text messages, and your email address. That is super important for us as we move forward so that we can reach you when it is your turn for redetermination and make sure that the information that we need is in our system to be able to process that application. We know that many folks changed places, addresses, phone numbers during the pandemic. And so we need to make sure that that is updated and ready for us so that we can best assist you as clients of our systems.
So make sure when you're going through your mailboxes and you're hitting all of those flyers and sale items and everything else that you get, that you're looking for envelopes that say the Department of Health and Human Services. These are important. These cannot be ignored. Do not put them aside. If you need help filling them out, ask a caregiver, ask a family member, or again, you can call the Department of Health Source and you can get all of the information that you need. Will everybody need to go through the renewal process?
There are certain groups that will be redetermined at different times. One of those groups are our children. Our children will be redetermined, I believe, in 2024, in March of 2024. That's correct, right, James?
January of 2024. So
January.
Our children won't be renewed until January 2024 because we want to ensure our kids remain covered. And our SSI enrollees will be renewed through Medicare. And our elderly and disabled Rhode Islanders are likely to be auto-renewed. But again, we'll make sure folks get notices about the processes that they will be going to based on their specific information within our systems. I can't speak for everyone because I'm not on our operations team. However, we do know that there will be some populations that will get specific notices that let them know that they will or will not go through this process at a specific given time. And again, we have a year to renew all 370,000 individuals. So it will be done in groups by months, and we will share that information with clients as their redetermination date is approaching. In most cases, folks will be redetermined based on the last time that they were redetermined with Medicaid. So for a good portion of folks, you may remember going through this process pre the pandemic. You've had this happen before where you've had to return applications, upload additional information or documents, or provide that to the Department of Human Services. We need you to remember that process, remember what those forms look like. We'll help you. We'll make sure we get information out there and share it with partners such as Tina. But then there will be a group of folks, I think it's about 170,000 individuals who enrolled and needed coverage during the pandemic because either of changes in job status when we had to close businesses and a whole host of other things during the pandemic times. And this will be your first time going through this process. And so we want to get out there and talk with you here today and moving forward over the next several months to remind you what that looks like, preview the information as it's finalized, so you know what to look out for.
And just to let everybody know, if you're not taking this all in or you're getting bits and pieces of this, do not be overwhelmed because RAMP is partnering with the Department of Health and Human Services to help them get the information out. So if there's information that we need to get out, we will be using one of my live stream partners, and we will be putting it out through all of the social media and any other way that we can get the word out there. So you will be notified not only by mail, but by me, by everybody, by EOH. This is not a one and done. We're going to be following up with them weekly. We're going to be making sure we stay on top of this, and we're going to be holding your hand every step of the way through. So don't feel overwhelmed. We will make sure that you get all the information that you need. Once people renew, is this going to be something they're going to have to do annually?
It's an annual process. So once people renew, they will have to continue to renew annually like they normally would with any other benefit.
What happens if their income increases? Does that change?
If their income
Jane?
increases?
Yes.
If their
I'm
income
going to let either one of you, whoever feels best to answer the question, please jump in because I'm not sure which one of you would be best to answer each question. So whichever one of you feel better to answer it, just jump right in.
Absolutely. So eligibility is determined based on a variety of information, program type, unique criteria to the individual, whether it's medical or non-medical, and then other factors such as demographics and items such as income. So that information will likely be needed for folks as they go through the redetermination process. We're going to try as much as possible to do what we call a passive renewal, which means an administrative renewal, get as much information as we can from our existing sources to make a determination and not have to require a bunch of documents on a consumer's hands to have to be uploaded into the system. That's kind of clunky, and we want to avoid that where we can. And move forward and get as many folks through the system and the redetermination as possible with the available information we have. That being said, we probably will need some additional information from a handful of our customers. And again, we will help you through that process. We will notice you that we do indeed need that information. We will work with our managed care and other partners to ensure that we are reaching you to share that message. And we've built in some additional safeguards as we move forward. So for example, for some folks, if you do not meet the eligibility moving forward for the Medicaid benefits, we are working to set up systems so you can be auto-enrolled in our Health Source Rhode Island plans without having a lapse in coverage. So we are working on that, and those details will be outlined in what we call your benefit determination notice, which will be the last notice you receive from us through this process. And again, I know this is complicated, so we will share more information as we have it available with you all, both here and in other venues. And we are working with our community partners to also be there and provide what we call client support services to help you through this process. Understand the forms if anything is unclear, help translate into another language if for some reason you get a version that is not in the language that you speak, and also provide assistance in gathering the documents that are being requested. And so we are going to try to do everything in our power to best serve you all as Rhode Islanders.
You guys are amazing. It's so good how my audience reads my mind, because my next question to you guys was going to be about fraud. And I'm going to go to one of my customers, my viewers' questions, because theirs is about fraud. How do they know that they're talking to EOHS? Is EOHS going to call them, ask them for their security numbers and stuff over the phone? How do they know that they're being safe and their information is being protected during this renewal process?
I would say only deal with EOHHS, only deal with EOHHS, Health Source Rhode Island, the Health and Human Service agencies, or your trusted partner agencies. If you get a call randomly, and it's someone that says, oh, I'm going to help you, all you have to do is pay me a retainer and I'm going to help you get into all the services and update your benefits. It is too good to be true. It is too good to be true.
Yeah.
And we really want to make sure folks know, if you feel that suspicious activity or just don't feel right about that call, or someone asks you for information like your social security number or your bank account information, that's not coming from us. All right. And so if you learn or feel that way, or learn about that, or questioning a call or feel that way, there are several ways you can, out of an abundance of caution, report these suspected fraudulent activities. That can be done online with the Office of Internal Audit fraud complaint form, and we'll make sure you have that link. It can be done by phone by calling the fraud unit and leaving a voicemail, and that's 401-574-8175. They will process that call and complaint promptly. And then you also can send it to the Fraud Detection and Prevention Unit at 1 Capitol Hill in Providence, Rhode Island.
And one thing that I will say to everybody that I always give when we talk about fraud is, if you think the Office of Health and Human Services is calling you and asking you for this information, you don't feel comfortable, tell them you'll call them back. Hang the phone up, don't give them any information, and call the number directly to the Office of Human Service or Health Source. Do not, if you're calling directly, you know you're calling the right part. Do not ask the person on the phone to give you the phone number, because of course they're going to give you a fake phone number. So just hang up the phone and call the office back yourself. And that's how you will also find out and keep your information safe. There are so many different communities out and about. How are you engaging, and how are you worried about not reaching certain populations?
EOHHS believes in the power of partnership. And through that vein, with the support of these wonderful partners that we have in the community, we're going to do our best to reach and communicate with as many folks as possible. And, you know, when we think about that, we're really thinking about how concentrated Providence is and how many resources there are here. But if you go north and you're going into our borders, some of those places don't have health equity zones. They don't have the Center for Southeast Asians. They don't have the resources that we do in Providence. So we are definitely making sure that we connect with partners all throughout the state. This is a national issue. So the fraud point that you brought up is really important. And so we really want to make sure that we communicate with all of our partners so that they can help the community stay aware, be ready, and stay covered.
And here is my plea to all of your partners and anybody who has a stake in this. If you are a community leader, a nonprofit leader, or you think that you're dealing with a population that may not be targeted or touched, or reach out to the Department of Health and Human Services. Offer your services, offer to reach out to them and say, hey, I want to make sure we get it to my community in their language, the way they get it, the way they see it. Reach out and become a partner. We're only going to do this together. We are stronger together, and we all need to reach out. You're not being forgotten on purpose with this huge project that they're taking on. Something is going to miss. It's always the way, but don't take it as in you're missed and forgotten and just cry about it. Reach out and say, hey, we don't want to be forgotten. We want to step up and make sure that our community is being targeted. So help them to empower you, to empower your community to step up. James, give us some other ways that you can empower partners to step up.
Absolutely. So I want to also just say we are focused on some of our key populations who we know might need assistance, and we know. So if you are a partner that works with our high density communities, as we experienced in COVID-19, are a member of the BIPOC community or lead a BIPOC led organization, work with our refugees, children and mothers, our elders, individuals with disabilities, those who have behavioral health or substance use conditions, those who are recently incarcerated or who are unsheltered or homeless. We need you. We need you to come to the table. We need you to help us reach these populations who we know will need help and support through this process. Through our communications and outreach plan, we are engaging with leaders and community partners in each of these populations, but we want to know who we're not engaging. We want to engage you authentically from the start. And that's why we have Kyla, who is our engagement specialist and director on here today, because that's critically important. Other things that folks can do is make sure they share the information. If you know family members or you know others who are on Medicaid, help them be ready so they can stay covered. Share that information. Make sure that they know what to look out for fraud. I know personally, my mom is since deceased, but I used to worry about that for her. And I used to think about, when a call would come in, whether or not it was someone phishing or scamming, and try to put that protective lens on myself, just as her son, and watch out for her and her benefits as she was going through her cancer treatment. That's something we all need to do. If you have folks or friends that maybe are homebound, maybe don't get out of line, are not technologically savvy, they might need your help. They might need you to come over with their laptop. Again, everybody needs to make those decisions on their own and trust those folks with their own information, and safeguard that. But that doesn't mean we can't be helpful neighbors, friends, family, and help one another through this process. And I truly hope that folks will do that. I know, Tina, I believe you have cards that you have in little packets that have emergency medical information and other things on that. Now's the right time to update that too. Let's do it all at the same time. To your point earlier, this is how we have to moving forward. And then I'm just going to need everybody to remember, you're going to have to be ready every year, because we're going back to the old way where you're not continuously enrolled in these benefits, where you get redetermined every year as we move forward. So once you get through this process and you have that sigh of relief, I hope, that you remember that we have to do it again. And that's important.
And it's going to be the same time every year for you to renew. So, when you do renew and you do have that sign of relief, keep that piece of paper by your side and say, okay, these are all the places that I need to update, renew, and keep fresh. You should be doing it every year. Things change every year. Health changes every year. Emails, addresses, phone numbers change every year. The people who are around you, unfortunately, pass away or move on or something. They change every year. Keep a list, keep a notebook. If you know of a resource in your city or town, like I know that there's a code red system in every city and town that we can tap into those lists, and we can make sure that the people on those lists are taken care of. Step up. The easiest way you guys can get the information out, share this podcast, share this information, share these sites, because we will be going live on these sites quite often to help people and guide them through the process. I'm going to take another live question if you guys don't mind. And one of them, James, you touched on a little bit, is what are you doing about the homeless population with all of the unsheltered and unhoused? How do you make sure that they're being taken care of?
Kyla, do you mind if I take this, since this is a passion of mine?
All right.
So working in collaboration at RIEOHHS with our Department of Housing and many other partners, we feel very strongly in offering the supportive services that we need to our unsheltered populations. And thanks to the incredible leadership of our Acting Secretary of Health and Human Services, Anna Novaish, we partnered with the Department of Housing, for example, to open the warming station that is available at the Cranston Street Armory. And part of that is making sure that we work with those partners to get those folks engaged in their coverage and benefits, and understand the changes that are happening. Because if they've moved around a lot, we're not going to have their updated information. But now we have a place, we have an address, we know where we can find some folks. And so we are actively pursuing the ways that we are partnering with folks like that. The other part of my work is working a lot on some of our epidemics, such as overdose. And we have street outreach and harm reduction and outreach partners who go to serve these populations day in, day out. And we're going to bring the message to them. And we're going to help ensure they have the resources to help others that are out in these spaces, to ensure that they are updating their information and getting the documentation that is needed. And again, in order to not lose that essential health coverage. And so we are working, that's just one example of, with existing partners, existing systems, existing places or hubs for some of our most vulnerable, to make sure we do this right.
Yeah. And as soon as Miss Tina gets out and about again, she's going to be going to all of those places, handing out her red bag so the homeless can have all of their medical information on hand with them at all times. So no matter what happens or where they go, they're going to make sure that they get taken care of. I can get some partner to come down to my house and pick them up. They can get out sooner, but that is one of our goals. Because, I used to help when I was out and about helping the disabled. There was a camp of 9 people, all in wheelchairs, all homeless and housed together on the streets. So every population is out there, every person, nobody is immune to it. Nobody wakes up and says, today I think I want to be homeless, so let's go try this on for size. So help everybody out. We want to make sure that everybody gets taken care of, everybody is accounted for, and every life matters. We need to make sure that we're touching everybody. Kyla, give everybody again how they can get in touch. I want to do it a couple of times throughout the show. So tell everybody where that they can contact to update their information on their own to get the process started.
So you're going to be able to go to healthyroad.ri.gov, Health Source Rhode Island, and use their web chat, or give them a call at 1-855-840-4774. Monday through Friday, and you'll be able to contact an assistant that can help you in English and Spanish. You'll be able to meet with someone at DHS offices, and those offices are throughout town. You can find locations on our website. You can go to the EOHHS website to find links there if you need to find links there. And I think that is all the places right now where you can log on and get some support.
And
Well, I have a
one
follow-up
more-
question. I have a follow-up question to Kyla from one of our guests. They want to know if it's not English or Spanish, how do they get the information, or how can they get helped if it's not English or Spanish is their language?
I think that's really where a lot of our community partners are starting to come into play. So if you are someone that accesses Dorcas International, that is a great place for you to go to start to begin to go down this process. We're going to have information translated and out to folks, but in the interim, use those community partners that you already trust, that already help you navigate these spaces to be that trusted partner and help you manage and understand what's going on.
And I want to tell everybody that they can go down to the Rhode Island Department of Deaf and Hard of Hearing for anybody that needs sign language to help them get through this process. I have already spoke with them this morning, and they are willing to translate whatever they need to translate for the deaf and hard of hearing as well. So I just want to throw that out there. James, I didn't mean to cut you off. I just wanted to get that question in while it was fresh in everybody's mind.
Absolutely, and it's super timely, and it's so important. And Kyla took some of the words right out of what I would say. But many of you, or many folks who might speak other languages, you know, have your sources of folks who help you with other items, whether it's immigration or a variety of other services. Don't be afraid to ask. That's about helping each other in our community and getting the resources and the support that you need. It's also about making sure that if you have folks that come in and help you provide care, whether it's a home care individual, a community health worker, or someone else, a case manager that's working with you, don't be afraid to ask and show them this and see what type of supports our providers can provide. We will be messaging to our provider audiences as well, so they are aware of these changes and how they can support. And then lastly, I want to give everyone a tip. If you have your insurance card from Medicaid and you turn it to the back, you will notice whether it's from Neighborhood Health Plan of Rhode Island, Tufts Health Plan, or the United Healthcare Community Plan, which is our managed care organizations, and you'll know which of those three you have. There's a number on the back that you can call and they can assist you. Most of our organizations, particularly our call centers, have the ability to use language lines and a whole host of other things in order, if they don't have the individuals that speak that language, to make sure they can help you do this. And they are ready to help update your name, your mailing address, your telephone number, including a cell phone number, because again, we want to get you through text messages as well so that you don't miss anything, and your email address. And we have it set up so those go and automatically update into our systems as well. So again, there's a lot of ways that we can reach you. There's a lot of ways that we can help you, but we need you to be ready. We need you to engage, and then we need you to stay covered.
Yeah. And, you know, here's a tip for everybody else. Here is the perfect fact that one person can make a difference. You don't need to work for Dorcas International. You don't need to be a part of RAMP. You don't need to be a part of the Asian Alliance. You could be one person that speaks a different language, and you know people in your community that speak that language that you can call up and say, hey, I speak this language. Give me the information so I can translate it for my neighbors in a way that they're going to understand it, because nobody knows them better than you, because you're the one who's interacting with them on a daily basis. You can bring it down to their level. You can bring it down in their language so you can help out. You don't need to be part of an organization in order to help out. This is where everyone can help everyone at this point. Step up. This is your time to step up and do something for your community. It's free, it's simple, it's quick, and you can truly make a difference, because getting people enrolled or re-enrolls is so important. You could literally be saving lives to make sure that they're covered going forward.
You're so right, Tina. And when I was recently at the Refugee Dream Center, we were having that conversation because it's not just about language, it's about culture. It's about how you approach people. How do you understand what's happening in that family? Who do you talk to? Is it a family where the male is the prominent figure and you have to go through that individual in order to talk about what's going on in the family? So all those dynamics are really, really important. And we're just so thankful to have partners like the Refugee Dream Center when we know that there are so many transient populations coming in and out of Rhode Island, to really be able to be on the grounds, understand them, and give them the support that they need.
Yeah. And I mean, the thing is coming from you, like, I know the disability community, me and Kyla could be in the same room and people are going to believe me, then they're going to believe Kyla, not because they don't like Kyla or not because, I live and breathe what they live and breathe. They see me living it. They're going to trust what I say is fact. That is the same way in every culture, in every area, and everything that we have going on out there. And we respect that. We want to see it from all perspectives. And we understand that our perspective isn't the be all end all perspective, that we need your perspectives to help us drill this down to make sure people not only are doing it, but they understand it, and they can understand it to keep renewing this every year, know what their rights are, know what their benefits are, and know that they're safe and they're covered. James, you must have something to add to that.
Of course I do. Of course. How did you know? It's like you're reading my mind. Go figure. No, I want to just reiterate that that moving forward, particularly as we get into April and this process starts, this is not the only time you'll hear this from us, okay? And that is not the only time you'll hear it from our community partners, those that you're already engaged with and those that perhaps will be newly engaged with at that time. You will see more information in the news, on posters and flyers within our communities, on public transportation, and a variety of other things. Another item that you'll see as we do this campaign and make sure that you are a member, and we have constant reminders for you that this is happening, and you open those mail pieces and you see those notices, is that you'll also have the information on our Healthy Road app. And so it's an app that you can download on your handy dandy smartphone. If you don't have a smartphone, that there's also a website that can be used. You may need to ask someone. You may need to ask, someone who's part of the family that you choose to help you or to use their device. But you can download that smartphone. You can change and toggle between English, Spanish, and Portuguese. So in terms of language, at least making it available in those three, where you can update your contact information, you can submit paperwork if you're requested to do so, and you can also check on the status. And so we are trying, again, to use text messages, notices via direct snail mail to you all, social media messages, podcasts, community engagement with our partners who live in the places that you work, that you live, that you play, that help you, and through this media campaign and through the value of technology in this day and age. And so we hope through those different mechanisms and the ability traditionally to call on the back of your insurance cards, if you haven't made a copy of that, I'm sure Tina's going to tell you to put that in your bag as well, to have a copy, because you never know when you're going to lose it, or you might be on the go and something happens to you and you want that with you. No reason, as soon as you make a copy of that in the next night or tomorrow, and you go to put it in your bag, make that phone call and have them help you update their contact information. There's no reason to wait. Be ready, engage now, and stay covered.
And you are absolutely right. Do not carry your actual card. Carry a copy of your card, because you are going to lose it. You are going to drop it. Things happen. Life gets in the way. I always say, put a copy of your card in your red bag. Keep your actual card at home, because that's where you're usually 90% of the time going to make that call. All of our webcasts and all of our live streaming has closed captioning. So you can read what you need to read and what you need to understand. Like I said, we're partnered with the Deaf and Hard of Hearing, so you can go to that way for all of my community. and any other accessible way that you need to get this information, let us know. We'll make it happen. Let me know and I'll find a way, because if anybody knows me for half a second knows I don't take no for an answer, that anything is possible with a little determination. So challenge me. Give me something you think I can't do and I'll challenge me. I will get you the information, and whatever way you need it, I will find a way to get it to you. That is the important part. Kyla, give us a brief overview for those who joined us late, because we have a lot of people watching with us tonight. Can you give us a brief overview of what we're talking about tonight and why this is so important?
Tonight, we are talking about Medicaid renewal or Medicaid redetermination. And this is a process that we normally would do every year, but due to the pandemic, we've been on a pause for the last 3 years. The federal government wanted to make sure that everyone stayed covered throughout the pandemic. And so that's why this was on pause. And as we start to come out of this pandemic, we want to get ahead of the game and make sure that we start to renew people so they can keep their coverage. So that means for the 350 to 375,000 Rhode Islanders that are on Medicaid, we want you to stop, update your information with your managed care organizations, with our Health Source Rhode Island, any way that you can get your address, name, phone number, email updated within those systems of care so that you can stay ready, get ready, because this information is going to come out, and you get the information as it comes out and it gets delivered to you. And you'll be able to find out from there, you'll get a letter that tells you when your renewal process will start, and you can start going through the process. One of the other things that people should know is that children and folks that are on SSI will be redetermined in a year. And so we want to really focus on our at-risk populations, our single adults, our populations of communities of disability, formerly incarcerated, our elderly, our mothers. We want to make sure that we reach out to people that are substance involved, that are without a home at this time, and really make sure we have a way to contact them, deliver the information that they need, provide them with the resources that they need so they can remain covered.
It's just so important. James, I have a quick online question for you, which confuses everybody. Somebody would like to know if you could give a brief synopsis of the difference between Medicare and Medicaid.
So Medicaid is predominantly administered by the state, whereas Medicare is that federal insurance provision that is provided. There's a small grouping of folks who have both Medicare and Medicaid benefits, but the majority of folks that we're talking about here are those that are Medicaid, that are our state-provided health insurance, some of which do have an overlap with Medicare. And so, for example, as Kyla mentioned, those who are on SSI, those will be redetermined through Medicare, and we'll be focusing on our Medicaid population. Again, the best way to look at that is take out that insurance card that you have, flip it over to the back. If it says Neighborhood Health Plan of Rhode Island, Tufts Health Plan, or United Health Care Community Plan, you know that's a state of Rhode Island Medicaid plan. And you can call that number on the back, and those individuals at those call centers are ready to help you update your contact information so it is in all of our systems so we can reach you when we redetermine.
And if you're really confused, call anyway, because the most that they can tell you is, nope, you got Medicare, not Medicaid. You're not doing it right now. It's not going to hurt to call and find out if you're really confused, because I know there's a lot of people that get them confused. So you know what? When in doubt, make the phone call. It takes 5 to 10 minutes. Make sure it happens. Make sure you're covered. Just make the call. James, what else can people do right now? I want to recap that for those who joined late. I want to make sure that they know what they could be doing right now to make this an easier process.
Absolutely. So we want folks to be ready so we can keep you covered. And the way that you can be ready is by listening in and being aware of the messages that will be coming out from the Executive Office of Health and Human Services, the Department of Human Services, and HealthSource Rhode Island related to this effort. Be ready to keep checking that mail in March and April and moving forward for those notices that you'll receive that will tell you when it's your turn to be redetermined and whether or not there's any additional documentation that is needed from you. Check those text messages to see if you've got an alert that comes from us as we move through this process. Make sure to never share your Social Security number, your bank account information, or other personal health information that we as the state will not be asking for as part of this process. And if you get that feeling in your stomach that something's not right about a phone call or an outreach, or it's not from a traditional partner that you've worked with, or it doesn't seem to be our human services call line, make sure you report that and report that as potential fraudulent activities. There's nothing wrong saying, you know what, I need to take your number down and I'll give you a call back and ask someone what they think, or look it up online or call and report it to verify first. The last thing we want is anyone as a consumer to be taken advantage of during this process. And so again, it'll be the state doing official state business, and we want you to be aware and alert for those things. So again, you can reiterate that. I know in the past, we put the numbers up on the screen and the forms that you can submit with the Office of the Internal Audit. If there is worry about fraud, we certainly can do that again throughout the show. And just to recap the number, if you are suspecting fraud, if you are concerned, please let us know, is 401-574-8175.
Repeat that again.
401-574-8175. Leave a message, and the folks who retrieve the messages process those calls and complaints promptly. There's an online form you can fill out as well. We will make sure you get the link, and you can also send mail to the Fraud Detection and Prevention Unit at 1 Capitol Hill in Providence, Rhode Island.
And if you forget all about it, just reach out and message me, and I can get in contact with these two beautiful people who are not only my colleagues, they are my friends. So I can haunt them and I can say, I need this form, I need that form, which they probably already going to send me. So that way I have them readily available. So just message this podcast. And we will make sure that we send out all of these forms. I will post them on my websites. I will post them on all of my social media. Again, we're here to hold your hand. We're here to help you through the process. We don't want to make it confusing. And if you get your letter and you know you have elderly neighbors or disabled or an encampment near you or whatever, reach out to them. Make sure you're helping them and you're guiding them of what they need to do. Write it down on a piece of paper and give that information to all of them as well. Be a good neighbor. Here is your chance to, put your karma in the right direction and be a good neighbor. Write it down and bring it to your neighbor. Bring it to an encampment. Bring it to somebody that you see that you think may not have the technical skills to do this online. Give them the phone number. Make sure that they have all the information they have. Be a guidance. Everybody can be a guidance. One person can make a difference in this process. Now that we're nearing the end of the show, since I started with you, Kyla, I'm going to start with James on this one. Give us a 1-minute wrap up, James, of why this is so important and people need to do their job.
Okay, so since the pandemic, we have had anyone who has been on Medicaid continuously enrolled in their health insurance coverage because it was vitally important that access to that coverage remained throughout COVID-19 in the event you had medical needs, in the event that you had to see the doctor and were feeling ill. And moving forward, the federal government has instituted a change. And so starting April 1st, 2023, so not that far away from here, we will be having to redetermine eligibility for all 370,000 individuals on Medicaid here in the state of Rhode Island. And so we need you to update your contact information via a variety of mechanisms that are available to you so we can reach you at the right time so we can keep you covered. That is the bottom line and the most important thing for us to work on together and for you to work on with all of those folks that you know on Medicaid to help them be ready to stay covered.
And all of those links are in the chat below. So again, just share this podcast and all of those information will go along with it. So like I said, if you do nothing else, share this podcast because you never know who on your timeline needs to see it. Kyla, here is your spotlight, my friend. Give us your 1-minute wrap up of why people need to engage in this process.
We need to keep you covered. As you know, there are things that keep coming at us. It's like we can't get away from navigating this world in these small mini pandemics. So it is important. It is very, very important to make sure that you continue to stay covered and you stay involved and you stay connected and be a good neighbor, like Tina was saying. So please know that we'll be back. We're looking forward to coming back in March. We'll bring a couple of other partners so that you can hear more about operations and you can find out some other information that you might need if you are a partner and need to be involved. And don't let this go. Don't get the notice in the mail and put it aside and don't deal with it. The first thing you can do is to make sure that you have your information updated. That's easy. That's your phone number. That's your address. That's your email address. Those are simple things to do. Don't feel like this is overwhelming or burdensome. The state has been able to get a lot of information from a lot of other sources that have your information that's updated. So you might just need to clarify a couple of things. It might not be that serious. So just attend to it. Don't put this aside. This is something that you don't want to do or wait to do.
And again, we're not a one and done. We're going to be doing live streams. We may go twice a week where we go live streams just to make sure and do it a 20-minute live stream just to make sure people are being covered and every community we want to touch. They do not want to leave anybody out. This is a big process. Nobody is being left out on purpose. We need people to step up, tell us about your community, and let us know how we can help your community. Don't sit in the background and, think that you're just being forgotten on purpose. That is not the case. This is a big process and we want everybody to be a part of this. So everybody step up, be a voice, be a leader, be a helper, put your karma in the right direction. We all need that. Do the right thing, be a good neighbor. I can't stress it any more than that. Thank you guys so much for being a part of this tonight. This is vitally important information. I'm so glad that we are getting it out to the masses tonight. And like I said, I will be seeing you guys regularly. So, you're going to be haunted by me. So be forewarned. But we're in this together and together we are stronger. So thank you guys so much for taking the time tonight and sharing your knowledge with everybody.
Thanks,
Thank you
Tina.
so much for having us. And remember, everybody, start opening your mail. Open your mail so when you get those notices, you are ready to engage.
And don't wait. Call your insurance company now. Let them know that make sure your address is up to date. Don't wait.
Yeah, make a notebook. Put all this information in a notebook so that way you can do it every year. Be a leader. But thank you guys so much. And as always, I am going to invite everybody back. Not next week. We're taking a week off because I will not be around next Wednesday night. But make sure you're coming back the following Wednesday, same time, same channel, and making sure you're getting all the information. Follow RAMP, follow me, follow RIEOHHS, and to make sure that you're getting one of these live streams to your communities to make sure that we are covering everybody. And as I always say, don't just sit there, make a difference. Have a great week, everybody.